Hi, my name is Marcy Martinez. I am the director of the Physical Therapist Assistant Program here at Shasta College, and I would like to share a little bit about our program with you. So this is a recording of our information session for you. And we're going to work through all of these topics about PTA program description, our Associates of Science degree curriculum, our application process, and then our admission process. So here is the website. If you would like to, if you have questions or you would like to look at our webpage and get all of this information on the webpage, you're probably already there if you're viewing this video, but you can get all of that information. So let's get started. So the Physical Therapist Assistant Program is an Associate of Science degree in Physical Therapist Assistant. It is a 2-year sequential program, a cohort-based program, which means we admit a certain number of students and they go through the entire program in order together. So we admit 24 maximum students with an annual admission of January start. So we start in the spring semester. So far we've had 2 cohorts graduate our program. We currently have a 96% first-time pass rate on the national licensure exam and a 100% employment rate of our graduates. So we're pretty excited and proud of that. So we are fully accredited by the Commission on Accreditation in Physical Therapy Education, also known as CAPTE. It is required that you graduate from an accredited program in order to sit for the licensure exam. So we do have full accreditation. Here is the accreditation statement that you can also find on our webpage, as well as a link that is a validation link where you can go directly to CAPTE and ensure our status. So with our program, there are 4 prerequisite courses in order to apply and qualify to enter the program. Those 4 prerequisite classes must be passed with a 2.0 or a C or better. We require anatomy with a lab. We do accept an online anatomy with an online lab at this time. Physiology with a lab, online with an online lab is accepted. Medical terminology and introduction to physical therapy professions. Medical terminology can be taken fully online, and introduction to physical therapy professions is only offered online. It's a 1-unit course that introduces you to the profession of physical therapy and all the various places that we work, the different specialties, the education process, all of those types of things. This is in lieu of having to go out and do observation hours in order to apply. So you must take this class. You can take it here. You can take it at Sac City College. You can take it at Mendocino College. There are various options, but it is a 1-unit online course as a prerequisite. We do have recency requirements for anatomy and physiology. So your anatomy and physiology courses must have been taken within the last 7 calendar years. An appeal process will be available upon application for those of you who may have been working in direct patient or client care in healthcare and related fields that use the knowledge and application of anatomy and physiology. So for example, if you've been working as a personal trainer, or if you've been working as a massage therapist, or if you've been working in a back office as a medical assistant, and you took your anatomy and physiology 8 or 9 or 10 years ago, you can appeal the recency process. You still have to take anatomy and physiology. You have to have taken it. So this is only to appeal that 7-year recency if you took them a while back. You have to document 500 hours in the past 2 years, and then I review those appeals and determine whether they are appropriate to grant the appeal for recency. This program is a hybrid program. All theory courses are presented as an asynchronous online course. So time management is really important in online coursework. And then you have 2 days a week of on-site labs. So you have more than 100 hours per semester of on-site hands-on work in the lab. And then you have full-time, 40-hour a week, 8-week clinical rotations at the end of semester 3 and the end of semester 4. So there are 8 to 11 units of physical therapist assistant core program coursework per semester. This allows you room for general education requirements for the Associate of Science degree. You have to take all the requirements for the Associate of Science degree, earn the degree in order to graduate from the program. So it's important that people know that. You can't just come in and take the PTA courses if you haven't already taken all of your GE, and I'll get to that in a minute. Semester 2 is a wonderful time for this. We'll talk about that. You have to consider that you have those 8-week clinical rotations in semesters 3 and 4. So it's really good to front load your general education if you can. I highly suggest taking them while you're taking your prerequisite courses, if possible, as much as possible. And based on conversations from current and past students, observations from faculty, we really recommend that if you're working during this program, that you only work part-time, 16 to 20 hours at most, if you're trying to work. This is a heavy program, and there's a lot of work involved, and we want people to be successful. So if you get a little bit too overwhelmed and overloaded, it can be very difficult. So this is where Jeff McCormick, our Director of Clinical Education, usually steps in during our live information sessions, but for now you have me. So I'm going to talk a little bit about our clinical education process. During semesters 3 and 4, like I said, you have the last 8 weeks of the semester are a full-time 40-hour-a-week clinical rotation. You are required to do 1 inpatient rotation and 1 outpatient rotation. Your inpatient rotation might be skilled nursing, it might be acute care, your outpatient might be a variety of different settings. So we have lots of places. We take very much into consideration what your interests are, where you would like to go, if there are things that you would like to see. We will not send you to a clinical rotation site where you have been employed. There are a lot of reasons for that. It just doesn't go well. So you will have novel clinical experiences that are not places that you have been an aide or an employee. We do try to keep you as close to home as possible. So we have clinical sites out on the coast. We have clinical sites in Wairika and Mount Shasta. We have sites in Chico, Red Bluff, Orland, so all over the place. And we try to keep you within a half an hour of home, if possible, for that 8-week clinical rotation. If you live in an area where we don't have a clinical site and there are some appropriate places that we might develop contracts, let us know as soon as possible, and we'll make an effort to develop some contracts in those places. So these are full-time rotations. You will follow the full-time schedule of your clinical instructor, whatever that might be. So you do have to be cautious with other work and any school requirements. You can't take face-to-face classes during that time, like for GE classes, for example, because you can't go to lecture on Tuesday and Thursday afternoons at 3 o'clock for 2 hours. You just can't do it because you're working full-time in the clinic during your clinical rotation. You also need to plan ahead financially to have that 8 weeks off of work and arrange with your employers that will be coming. So it's just important to think about in advance. Sorry, moving this thing around. So let's talk a little bit about our associate's degree curriculum in general. So there are associate's degree requirements. You have to have 21 units of general education, and 3 units must be completed in each of these following areas. Your natural science is already taken care of with your anatomy and physiology. You need social and behavioral sciences. You need humanities. You need language and rationality and English composition, including oral communication and analytical thinking. And then you need multicultural living skills now, but by the time 2025 comes around, so next year, this multicultural living skill is changing to ethnic studies. So you will need an ethnic studies requirement. We have recommended courses in each semester of our program plan on our website. Some of those may change a little bit as we take the multicultural out and put in the ethnic studies, but all else is remaining the same. So you do need to complete those 21 units along with the PTA specific program requirements in order to graduate with the AS degree. So in semester 1, you'll have 11 units of PTA specific stuff, and then you can have up to 14 to 17 units total with the recommended courses that we have here. You can always carry more, and you can change this. This is just a recommendation. And really my biggest recommendation is to make an appointment with a counselor. You can find our counselors' information. Mindy Marlette and Robert Waldron are our health sciences counselors. And I would strongly recommend that you make an appointment with them prior to applying to the program to make sure you have everything in order and that you get a nice plan set. Semester 2 is a little bit lighter semester. You have 7 units in the program, and then with the recommended courses, you have up to 13 units total. So this is a good semester to load up on your GE. These PTA program courses are full 17 weeks. They're slightly less load than semester 1. You have no clinical rotations that you need to worry about. So this is a good time. Also summer. Summer's a good time to take general education too, because we don't have classes in the summer for the PTA program. Semester 3, you have 10 units in the program, and with our recommended courses, you have up to 16 units total here. Remember this clinical practicum, right? This is a lab that you get units for, and this is an 8-week full-time clinical rotation class, 40 hours a week. So these courses are only 9 weeks long. So it's a lot of work. Your labs, we have 54 hours per class per semester. So in 9 weeks, we have 6-hour labs. So those are super fun. And we're, but it works. And then you go out on your clinical rotations for those 8 weeks. Same thing happens in semester 4. You have 12 units in the program. These courses are 9 weeks long. And then you have your last 8-week full-time clinical rotation prior to graduation. So if you follow the plan that we've set forth, you should have finished all of your GE courses by the time you get to this semester 4, which leaves you 12 units in the program and a little bit of time and flexibility to prepare for your licensure exam. So that's part of the effort there. But if you do have some associate's degree requirements left, you need to take them here. So if you come into the program with a bachelor's degree, the good news is that you're exempt from the GE requirements. So in that case, you have fulfilled the requirements for Shasta College's Associate of Science degree, and you will be able to take the PTA coursework only, and then supplement with some other courses that we can recommend for you to get 12 units if you need the units for financial aid and things like that. So that's where it's a great idea to meet with the counselor. So let's talk a little bit about the application process. So like I said, we have the prerequisite classes, anatomy, physiology, medical terminology, and intro to PT professions. Those courses may be in progress to apply. What that means is our application process is in the fall, so August, September, for a January program start. You may be taking courses in the fall semester when you submit your application. That's okay. You can do that. You will have to complete those courses successfully with a 2.0 or better if you have been invited into the program in order to start the program. Candidates who have completed all of their prerequisites at the time of application submission get moved up and have priority status in the admissions process. So they'll go ahead on the list of those people who still have things in progress. It's just how it is. We need official transcripts from all the colleges that you have attended. We don't need high school transcripts. We need college transcripts except Shasta College. We have those. You may submit electronic transcripts. The electronic transcripts go to our admissions and records office, but you must include your receipt for your e-transcripts in the application packet. And you must include any hard copy transcripts in the application packet in the sealed envelope that they came in. Do not send hard copy transcripts to admissions and records, only e-transcripts. I'm going to talk a little bit about clinical requirements, the immunizations, the titers. These we have based on all of our clinical sites that we send people to, right? We are guests in their house, so we have to follow their rules. And this is what they require of all of our health sciences students, PTA, nursing, LVN, dental hygiene, all of them. So all of the health sciences students have to do these clinical requirements. The important thing about the clinical requirements is that you need titers. So a titer means that they draw a lab test to determine whether you have immunity to these different things or not. And if you don't have records of your previous vaccinations, you may need to go get boosters or redo the vaccinations and then have the titer drawn, which is why we want to give you this information up front. My biggest thing about clinical requirements is that there's a page of information in the application, and I highly suggest you take that page to your healthcare provider and say, this is what I need, and ask them to help you, because you need a certain type of titer. You need quantitative, which gives us specific numbers, not qualitative. So there's a difference. So take the page from the application that has all of that information on it to your healthcare provider, and they will help you with that. So what's required? So for Tdap, right, which is tetanus, diphtheria, pertussis, you need proof of a one-time dose as an adult. A Tdap is good for 10 years. So if your Tdap is older than 10 years, you can go get a booster, and then you can submit proof and documentation of the booster. So for varicella and measles, mumps, and rubella, varicella is chickenpox, right? Just because you've had it does not exempt you from this. You either have to provide proof of the 2-dose vaccination series or proof of a titer showing positive immunity. So both of these are 2-dose vaccinations, and the doses are given at least 4 weeks apart. You can get a titer after you get the 2 doses, but you must wait a minimum of 4 weeks, usually 6 to 8 weeks after your final dose. So you want to start these things early if you don't have your old vaccination records and you're going to need to go get updated. For hepatitis B, we need a titer. So the problem with this is that this hepatitis B vaccination series can take 4 to 6 months. And then you have to wait a month after your last vaccination to get the titer drawn. So this process can be like a 7-month process to get the titer. So you need to start now. You need to go to your healthcare provider, take them the piece of paper from the application, which you can download from our website, or you can pick up in the health sciences office, and take those to them to show them what you need, right? So a quantitative titer shows numbers. So how do you get the titers? What do? You obtain a lab order from your provider to have your titers drawn. So you can go to your primary care provider, or you may visit websites like schooltiters.com or requestatest.com. Look for the immunity panel test to have a lab order emailed to you. You can do that to have your titers drawn. If you haven't had your vaccinations in a while, you can go get the titer and see if you're immune. And if you are, then you're good. You give us the titer. And then you go get the blood drawn for a quantitative IG titer. And then you have to have the surface antibody Hep B. Okay. So You can email your requirements before the application filing period to this email address, hsupconnect@shastacollege.edu, for review, and they'll let you know if you have what you want. Anytime during the application process that you want somebody to look at your stuff to see if you're getting it right, either contact the health sciences office or, so this is what a titer looks like, a titer list. Contact somebody in the health sciences office, especially Audra Frazier, and she can certainly help you and review things and see. So here is some information about the immunization questions. Hepatitis B can be up to a 6-month process. There's one that can be completed in 4 weeks. You might ask your provider about that one. And then make sure that you're getting the titers, that you are showing immune. If you are showing not immune or not converting is what they call it, then submit a copy of all your vaccination and titer records to show us that that's the case, that you've done the vaccinations, you've done the boosters, you've done the titers were positive, meaning that you are not immune. And then you've tried other things and it's just not working. You're just one of those people who didn't convert. And then at least we have the documentation. So there you have it. That one is complicated. And if you're not done, you haven't received all your titers, you haven't finished your Hep B series, whatever, you can still submit your application. It will be considered as in process, just as if you had a class in process in the fall. Give us all the documentation about where you are in the process so that we know, but you can still submit your application even if you haven't completed all of the vaccination series. You do have to have them completed successfully before you can be admitted into the program in January. So there is that. The filing period for 2024 is Monday, August 26th through Friday, September 27th at 4 o'clock. All documentation must be together in a sealed envelope. There is a checklist provided in the application packet. I highly recommend that you use it and check things off as you go. Make notes on it about things that are missing. For example, if you have titers in progress, things like that. The application packet must be received or postmarked within the filing period. We use the postmarked as your application submission date. So applications will not be accepted if outside the filing period, which means if you postmark something on August 23rd, that is outside the filing period. It has to be postmarked August 26th. And even if it arrives to us on August 30th, your filing date will be considered August 26th. So it has to be postmarked within that filing period. You can postmark it on September 27th. If we receive it on October 3rd, your postmark still counts and we will accept that application. So if you are mailing your application, you need to send it certified mail, because standard mail no longer date stamps the postmarks. So we need that date stamped postmark, and you need some proof that we received your application. So, a signature upon delivery is an excellent thing. You will then receive email notifications by the end of October for a January start. So let's talk a little bit about how we pick who gets into our program. It's pretty simple, really. The first 24 qualified applications that we receive will be invited into the program. And then we do invite 12 people onto the alternate list, because every year we invite the 24 and a couple change their mind or go somewhere else or do something else. So we invite people on off of the alternate list to try and fill our 24-person cohort. So each day, for example, if on August 26th, we receive 35 qualified applications, which hasn't happened yet, by the way. But if we did, we have a process in place we will randomize those applications. So they'll just be put into a drawing, and the first 24 that we draw, 1 through 24, will be invited in, and then the remainder will be drawn in order for the alternate list. If not selected, every applicant, including people on the alternate list, must reapply. You will not have to resubmit transcripts. We won't make you pay for those again. We'll keep them. So if you're going to apply again, we'll have them on file. If you submitted your application on day 1 of the filing period and there was a randomization and you didn't get in, it was a qualified application and you didn't get selected in the randomized draw, and you submit your application again the following year on day 1, we'll put your name in the drawing twice. So we're trying to give you a better chance to get in that second year, as long as you've been on top of things and you submit your application on the first day. So there's that. We haven't had to use that option yet, by the way. So it just is what it is. So once you're invited into the program, prior to the January start date, so between October and January, there will be some things that you're going to need to take care of. You're going to need to do a background check and a drug screen through the Shasta College approved providers. And so the background screen and the drug check are going to cost you about $108 for the two combined. You also need to have a current CPR certification. Online will not be accepted. American Heart Association is the most preferred, but you will need that to be current in order to start the program in January. If you're moved up from the alternate list, if you're on the alternate list, we're not requiring that you do these up front until you get invited into the program. And then there'll be some time considerations allowed. But there is a deadline for these things that has to be done prior to the start date. And usually it's in December. So it's in December that these have to be finished. There's also a mandatory orientation if you get accepted into the program. It's in early December. You will be granted access to a Canvas course called the PTA Student Guide that has all kinds of information in it, including an anatomy boot camp, which is a massive review of musculoskeletal anatomy. And it's really important that you come into the program with a foundation and an understanding of musculoskeletal anatomy, because it's a big foundation for what we do. And one of the biggest struggles that students have, especially in the first semester, is lack of a good foundation and understanding in musculoskeletal anatomy. So we give you a chance to brush up on it before you start the program. And then you have access to that anatomy boot camp the entire time that you're in the program. So you can use it to review, you can use it to help study, you can use it in conjunction with your other coursework as a resource and a reference. So we try and do that for you. So at the mandatory orientation, it is on site. You have to be here. We go through program expectations and policies. We introduce as many faculty as can show up. We talk about time commitments and professional behaviors and what the program expectations are, what we expect of you and what you can expect from us. We talk about our grading policies and how the program works in general. We give you a little bit of an introduction to Canvas, our learning management system. You should have had some access to that already if you took the prerequisites. But we do talk about how to navigate our program specifically in Canvas and how it works. And then we have a Q&A. We'll give you a little tour, all that kind of stuff. So folks on the alternate list may attend. You will be invited to the orientation, but it's not mandatory. If you are invited to the program and you did not attend, you'll have a one-on-one orientation with the director. It's me. If you're moved up into the program. People from the alternate list may be invited as late as the end of the second week of the semester in January, the spring semester, but no later than that, because if we're later than that, then you're too far behind and it's just really difficult to get caught up. So we've had people come into the program within that first week and a half of the program and do just fine. So here is our website. You're probably there already. And that is all the information about our program. Please feel free to email me at mmartinez@shastacollege.edu if you have any questions, or you can email Audra Frazier at Frazier, Fraizer, @shastacollege.edu. Or you can stop by the Health Sciences Office at 1400 Market Street in downtown Redding, California. We hope to see you soon.